Hi, my name is Liz, and I'm a clinical pharmacist in Allegheny Health Network. Today, we're going to talk about how to use the FlexTouch insulin pen. The FlexTouch pen is the delivery device for Tresiba insulin, which is the brand name of insulin degludec. It's used to treat diabetes. The U100 pen can give up to 80 units per dose, and the pen contains 300 units. That's 100 units per milliliter and 3 milliliters in each pen. The U200 pen can give up to 160 units per dose. The pen contains 600 units, which is 200 units per milliliter and 3 milliliters in each pen. The medication is delivered subcutaneously or under the skin. It's administered once daily without regard to meals. Let's review the device components. You'll see the dose window, the dial, the injection button to inject the insulin, which is an easy touch button that does not extend as you dial up the dose for ease of use, and the pen cap. The insulin inside the pen should be clear and colorless. Check to make sure that this is the case before each dose. You'll also need a pen needle and an alcohol swab. First, wash your hands and remove the cap from the pen. You'll swab the rubber seal on the end of the pen with your alcohol swab and remove the paper seal from the pen needle. Twist the pen needle onto the end of the pen until you feel some resistance. Remove the outer cap and save this for later, and then remove the inner cap, which you can throw away. Before every dose, it's important that you prime the pen to ensure that you get the entire dose and that the pen is working properly. Dial up to 2 units, which you can see in the dosing window. Hold the needle facing up and tap on the side of the pen to ensure that air bubbles rise to the top. Press the button to push the insulin into the needle and out of the pen. You need to see the insulin coming out of the needle to know that the needle is primed. You may need to repeat this step until you see insulin coming out of the tip of the pen. Next, let's inject the insulin. Swab the injection site with your alcohol swab and dial the pen up to your prescribed dose. You'll inject the pen at a right angle to the skin, making sure that it's flush. Press the button to inject the dose. As you press, the dial should go back down to 0. After you inject the entire dose, leave the needle inserted for 6 seconds. After 6 seconds, pull the needle straight out. Do not rub the injection area. Put the outer cap back onto the needle and pull the needle straight off the pen. Dispose of the needle in the sharps container. Never use needles more than once. Then you can recap your pen and store it in a safe place prior to next use. The pens can be stored in the refrigerator before the next use, but it's important to remove it from the refrigerator 1 to 2 hours before injecting for a more comfortable injection. Open pens can be stored at room temperature for up to 56 days. The pens dial in increments of 1 unit if it's the U100 pen, or 2 units for the U200 pen. The minimum dose is 1 unit for the U100 and 2 units for U200. The pen will not dial to a dose that is more than what is left in the pen, and the dose is adjusted by your provider for optimal blood sugar control. The most common side effect is hypoglycemia, which is low blood sugar, which can make you feel dizzy, shaky, or sweaty. Call your doctor for instructions if you miss your dose, and never double up on doses.